So this next position is going to focus on mobilization or stretching of the back part of the shoulder, portions of the posterior aspect of the rotator cuff, as well as the back part of the shoulder capsule. This is a common culprit in people who are overhead athletes, especially throwers, swimmers, volleyball players. And the two major areas that we stretch in the shoulder, one being this pec or anterior aspect, the other being these back part of the musculature that I just talked about. So the way I like to go about it is you start off starting to roll towards that involved side. Now, the goal is going to be to get my elbow right around shoulder height. Now, if I go to do this and I get more pressure or pinching in the top of the shoulder as opposed to stretching, that's not what I'm looking for. So I'll show you a couple variations. So starting off here, I turn a little bit to the side to try and stop my shoulder from popping up forward. If I do this laying on my back, it's really easy for me just to compensate by lifting this part of my shoulder up. Turning just slightly to the side helps anchor my shoulder down against the ground. Hand on the back of the wrist, so I'm going to very slowly push down towards the ground to where I feel some tension in my shoulder of a stretching sensation. Same thing, initially you may just want to hold this for a short duration, 5 to 10 seconds, and do 10 of them. But as it's feeling like a pure stretch, I would have someone hold this for 30 seconds and do 5 of them. Now, if I'm getting any pressure pinching on the top of the shoulder and not feeling pull in the back, I will have people bring their elbow a little closer to their side and press down here. This puts a little less pressure on the top of the shoulder and may allow you to feel more of the normal stretch as opposed to a pinch or uncomfortable sensation. Now, if this position is just not working out for you, because some people have a little bit too much impingement up here for this to be a good exercise, there is another option. So for this one, I'm going to stand up. And I'm going to grab a wrap. This could be a towel, a pillowcase, anything that's rope-like. And I'm going to take my arm behind my back. Okay? Now, starting off here, if I'm focusing on my left shoulder, I have my left palm facing backward and my right palm facing forward. Now I'm going to stand up nice and tall, and I'm going to start to just pull my hand across the back of my hips. Now, as soon as you feel the lightest bit of tension, you're going to stop and wrap this around your side, because once you get there, you're going to squeeze your shoulder blades in this down and back direction, and it's going to pull more. So I always tell people not to have a very strong stretch initially, because when you pinch the shoulder blades in that down and back, it's going to be a stronger stretch. Now the goal with this is going to be gradually getting further and further towards my opposite hip, wrapping this around and then doing that same squeeze down and back. And then once I get to the opposite hip, I can actually start pulling this arm upward to go above my pelvis, doing that same squeeze down and back. This will be another one, initially 5 to 10 seconds. It could become 30 seconds. It feels okay. The key is that I never want to have this window of space between my elbow and my rib cage. So that's why it's important to first go across and then come upward, as opposed to just jamming my shoulder upward, which will be painful and uncomfortable in the top of the shoulder. Without the strap, this is something that can be even done just with your hands. If I just focusing on my left shoulder, use my right to take the left across, and then same thing, once I feel a little bit of tension, doing that squeeze down and back. And then a lot of times I will tell people that as they're getting up towards that hip, they can even start walking their way up their opposite forearm or elbow. And then same idea, once they feel a little tension, squeeze into this down and back direction. Initially 5 to 10 seconds, working up towards 20 to 30 seconds, 5 reps.